So today we're going to talk about chronic infections and how to interpret blood so you can see signs of chronic infection. We're not going to get into details about specific tests for things like Lyme disease or so forth. We want to talk about basic white blood cell count. It's called part of the CBC and the differential. This is standard blood work that people get all the time, and even though they're getting it all the time, I think show up on it, they're constantly being told by medical doctors that everything is normal when it really isn't.
Absolutely. What's really important to notice when you look at blood work is that blood work is not the optimal range. What does that mean? That means that that's the so-called normal range, a range when you don't have to actually be medicated. But it doesn't mean that it's a range of when you're healthy. So you may be in this normal range, but if you're at the very cusp of the so-called normal range, well, you don't need medication. You actually don't have enough of whatever it is on blood work to feel healthy.
Yeah. So when it comes to these labs, what a medical doctor is really looking for is, can I give this person antibiotics? Now, in conventional medicine, if you don't give someone antibiotics for an infection, you really aren't doing anything else for them. I mean, that's the only tool in their toolbox. So that's going to be really how they interpret these labs, right?
Absolutely. They're basically looking, when do we need to give you medication? They're looking, do we need to give you antibiotics? Or do we need to give you, say, thyroid medication? Or what kind of medication do you need? Oh, you're in the normal range. That means you don't actually need any medication, which means you must actually be fine. It's always important to actually get a copy of your lab results, because I see so many people who come into the office and they say, oh, well, the doctor said everything was normal, but as we were just saying, normal is actually very relative.
Yeah. Now, sometimes the labs have everything in reference range, and the doctor really isn't looking at that carefully. They don't care that something is kind of skewed. But, also a lot of times you might just see things blatantly out of reference range, and the medical doctors still ignore it. I see that all the time.
Absolutely. And some things they'll do, say for cortisol or for hormonal testing, they'll do a one-spot test, and they'll say, well, it's normal. But what they're not really understanding is that these hormones actually fluctuate, whether it be throughout the day or throughout the month. So looking at one moment in time doesn't actually tell you about the rest of the month or the rest of the day. For example, with cortisol, it's supposed to follow a very specific pattern. So you could be going in the afternoon, and while it's normal in the afternoon, it may actually be very abnormal at night or in the morning.
Yeah, and that's why you have to consider all these lab tests kind of with reference to the actual case history, because all these labs are going to fluctuate. Sometimes people come and they had a simple blood test done 1 week, and then they had it redone the next week, and things are different, and they think that their body shifted. But no, their body didn't shift. Nothing changed, except they just did 2 different blood tests, and it's not going to be exactly the same, every time. So understanding that different times of the day, that's going to affect lab test results, sometimes what someone ate, what type of stress they're under. We don't want to interpret these numbers that we get as like hard, definitive, this is exactly where you are. This is more of an indication of what specific systems are doing than this type of super specific analysis that sometimes people may try to make it out to be.
Absolutely. Now, I think today we're going to concentrate mostly on infections, and there's 2 main types of infections that we're going to talk about. We're going to talk about the acute infections versus what are called chronic infections. So by acute infections, we mean something that comes on relatively quickly. Examples of this would be colds, flus, any sort of upper respiratory tract infection that you would get, where you have a lot of symptoms. You get redness if it's some sort of infection from a cut or something like that, or you get a lot of mucus, a fever. You just generally don't feel well. And that's signs that the body is actually starting to heal itself.
Yeah, I mean, sometimes people will say, oh, my immune system is fine, I never get sick. That doesn't necessarily mean the immune system is good. That can mean that the immune system is so weak that it can't even mount a response. And the point is that these signs of infection that we typically think of as bad, they're actually good because this is the body's response. What would be bad is if someone just doesn't respond at all, and then they can start going down a path towards certain chronic illness as a result of a non-responsive immune system.
Absolutely. And you know what? A great example of that is, say a young child gets a cold versus an old person. A young child typically has a very strong response when they have a cold. They have a lot of vomiting. They have all this diarrhea. They typically get a fever. They tend to produce a lot of mucus. Why is that? Because that's the body basically fighting off the invaders. That's the immune system doing what it's supposed to do. But in an older person, they get basically a cough because they no longer have the vital force to really fight off the invaders, if you will.
So many times people come in and they say, oh, I used to get this or that when I was a child or a teenager, but then it just went away. And they interpret that as meaning the problem went away, when I really looking to interpret that as what problem did their body just stop with, and how does that relate to their current problem, whatever current symptom they have, which is actually more of a deeper problem because it resolved the initial reoccurring infection.
Absolutely. And that's one of the things we see in people that have a chronic or this subclinical infection. They are people who very often never get sick. And that's a very common theme in people who have any sort of autoimmune illness or who have any sort of deep-seated issues. They never get colds, they never get flus, but they have other things. They have things like fibromyalgia, they have things like depression, they have a lot of fatigue, they have a lot of recurring things like urinary tract infections.
Yeah, and let's go through this list. I think fatigue is pretty clear. If you have this infection that your body isn't clearing, it's really going to wear down energy production. It's going to stress out the adrenals. You're not going to feel good. But if we go to other signs of a chronic subclinical infection, I would list reoccurring active infections. Like if someone has tonsillitis that comes and goes, or a urinary tract infection that comes and goes on and off, I look at that as not something that's coming and going, but as something that's always there. It's just what's coming and going is whether or not you see the immune system responding to it.
Absolutely. And very often these acute infections, what happens is they go undetected. So you treat the urinary tract infection, and then you no longer have symptoms. But then when you become under stress, it lowers the immune system, and then the urinary tract infection basically flares back up again. It's not a new infection. It's the same infection that's just allowed to flare back up again. So every time you treat it, you basically put it on the level that you no longer have symptoms. But it's still there, and that's one of the problems.
Yeah, and people don't understand that with antibiotics, where they'll have this thing that comes over and over again, and they will keep on taking antibiotics for it. So now what I finally just say is, if antibiotics really took care of your urinary tract infection, why did it come right back after a couple months? What the antibiotics really do is they kill off the infection in a certain area. They bring down the immune system's response, but it doesn't necessarily, first of all, nothing's ever going to clear your body of bacteria. There's no such thing as a totally sterile environment. But besides not clearing your body of bacteria, what we can say is it actually starts to push disease deeper into the body, where initially someone might have very superficial infection, like you might have a sore throat, and that person keeps taking like antibiotics for a sore throat, then later on they get like the urinary tract infection, and so forth. And then you can start just moving down to more severe diseases by continuously taking antibiotics and getting all the problems that come from that.
Absolutely. And, these subclinical infections can cause other things as well. They can cause many dental problems or nerve pain. I know I had a client here in my office that basically was having all of this nerve pain after having all of this dental work done. And I said, well, it sounds like you have some sort of infection. And she said, well, they look and they don't find any infection when they do the blood work. And I told her that it's probably a subclinical chronic infection that she had that's just not going away, because she'll go on the antibiotics, the symptoms go away, and then a few months later, the symptoms just come back.
Yeah, with dental health, there can be infections there, but unless you actually have those signs of acute infection and a writhing in pain, when you go to the dentist, they're going to be like, oh, there's nothing there. All that means is that it's not presenting in this immediate way. You don't have this immediate, robust immune system response. But you can still have problems there, and maybe you don't have this acute, obvious infection, but you always have some sinus issue going on, or swollen lymph nodes, or something else going on in the area that indicates an infection. And the more recent research shows that a lot of dental work for dental health is associated with cardiovascular disease. And this relates to the whole concept of the subclinical infection, because the idea is that through the dental work, you don't have that acute infection, but you just constantly have this chronic load of bacteria entering the body, and that causes the inflammatory response, which results in cardiovascular disease. But this relationship between dental health and cardiovascular disease is not about the acute infection that you run to the doctor for antibiotics. It's about the chronic infection.
Absolutely, and it's important to understand the link between the chronic infection and the mental symptoms. A lot of people get diagnosed with things like chronic fatigue syndrome, fibromyalgia, depression, anxiety, because they don't present with signs of an acute infection. But when you look into their history, you find out that they've had a history of past chronic infections, and you look and you say, they'll tell you, well, I used to get a lot of urinary tract infections, but I no longer get those. Or I used to get a lot of eczema, a lot of psoriasis, and I no longer get those. And all of those things are greatly linked to what kind of overgrowth of bad bacteria are there that aren't necessarily measurable on typical CBCs and regular blood work.
Yeah, anytime someone comes in with depression, anxiety, anything like that, you have to consider the immune system. I mean, you can start explaining this through various mechanisms in a simple way. It's like something is there and it's triggering the nervous system. The nervous system can get all ramped up, and that can lead to anxiety. Or maybe there's an infection there and it's just wearing down the system, so there's low energy, and that could lead to depression. Those are simple ways of looking at this. But you do see clinically someone has mental symptoms, and when you look at labs, you start seeing signs of chronic infection. I put up there PANDAS, pediatric autoimmune neuropsychiatric disorders associated with streptococcal infection. We could go have a whole other discussion about that an acronym, but that's just simply a group of people who noticed that in many children diagnosed with things like ADHD, what they really have is chronic strep infections that's been going untreated, and that at least the anxiety symptoms or the ADHD symptoms would improve when given antibiotics. That doesn't mean I approve with that antibiotic approach, but it's good that they're putting out that information that these children really don't have a mental disease. They have a chronic immune system problem, and you need to support the immune system somehow.
Absolutely. Now, when we look at the lab work, moving on, when we see increased white blood cells, that usually represents some sort of acute infection. Increased white blood cells, those are the immune cells in our body. Those are basically the cells that go out and attack whatever invading force is there. They'll go after acute bacterial infections, such as urinary tract infections, or viral infections like colds, flus, and all of the childhood diseases, like chicken pox and things like that. Those kind of diseases will increase the white blood cells. But the chronic infections that we see actually decrease the white blood cells.
Yeah, and then when we look at the reference ranges, you can have this really big conventional range, 3.7 to 11, but an optimal range that's a lot more narrow, 5 to 7.5. Now, if someone's out of that reference range, they really want to look closely at the immune system. They have signs of constant infection, or they have signs of their body not responding, and it really should be taken much more seriously than, it's just a number, it's just another lab. But a lot of times, just one of these labs that we're going over might be the only sign of a chronic or subclinical infection. So you really do want to take it more seriously. And the longer I practice, the more people I see, the more appreciation I actually have for this basic CBC, white blood cell count, and differential we're going to go into.
Absolutely. And it's also important to realize that even things like diet can affect the white blood cells. For people who are on a raw food diet, that can often cause a decreased white blood cell count, in addition to these chronic infections. Yeah,
there's always like little sign-ups. There's the most likely things that's going to change these levels, and then there are some other things. Raw food diet, decreased white blood cell count. So that can happen with raw foods or vegan, vegetarian diets. You might start seeing some skewing of numbers. That's something else to be aware of.
Absolutely, and that's why it's so great to go in and really talk, because we're going over what these things mean, but they're always much more complicated, and that's one of the reasons why it's always good to go see someone and actually bring your lab work, because they know exactly what to ask you to figure out what's causing these lab values to be out of the optimal health range.
Mm-hmm. So if we go to neutrophils, neutrophils are a specific type of white blood cell, and their job is to go after primarily bacterial infections. Now, neutrophils can go by so many different names on lab tests. You're often going to see them go by the name of polys. Those are neutrophils also. So if you see some other name, hopefully it shouldn't be confusing. It should be clear that these are polys, neutrophils. They're all the same thing. I don't know why different labs have to qualify different stuff. Conventional range around 35 to 70%, but you really want an optimal range of 40 to 60. And at least with my clients, I've seen a lot of people where it's high out of optimal range. It's like there's an infection going on, there's some chronic infection, and some of the other numbers we're going to get to are low, but the neutrophils are like 65%, 67%, 68. You get like those types of numbers a lot of times.
Now, there's something else similar. They're another form of white blood cells, and they're the lymphocytes, and those are usually elevated when you have the acute infections, and even when you have the chronic infections, those can be elevated as well. But it's also interesting to notice that they're elevated whenever there's any sort of inflammation or overall toxicity in the body.
That's definitely a sign of a problem. And you want to go after mononucleosis that can be elevated there. So a lot of times, like, you'll see interest in running a lot more fancy lab tests. Sometimes I see that now where people will want to run like every test imaginable for this viral infection and that viral infection. But a lot of times I feel like you can get just the relevant information that you need right over here. Also, for people who have issues with insurance, it's not practical for everyone to run in there and get tested for every viral infection possible. I'm not saying don't do that if you're able to, if your doctor's going to run it. But I've seen lots of people for like whatever, for insurance-based reasons or financial reasons, they're not going to have that testing done. But I don't even feel like I really need all that testing in order to know, okay, we have to work on the immune system. And also the natural health, you're not concerned so much about what the specific microbe is. You're concerned about the health of the person and how to improve that. And honestly, when it comes to things like Epstein-Barr virus, for example, we've all been exposed to it pretty much. It's just someone with a weakened immune system who's going to be susceptible to it. And that's why it's important to know how to interpret this lab instead of ignoring this and then going out and running this viral lab or that viral lab. You can start, going crazy running additional lab work.
Absolutely, and as you just said, it really is about addressing the deficiencies in an individual. Not everyone who gets exposed to a certain type of virus will get it. Only the people who have a proper terrain for that virus or that bacterial infection will actually grow that sort of infection. So if you give the person things to help support the immune system, to help their overall health, they'll be able to fight it off. But that's a problem when it comes to something like traditional medicine, because their first response is, what drug do I give you to kill off whatever bacteria or virus you have? If you're giving a drug for that specific purpose, then you really have to know exactly which type of virus or bacteria you're dealing with, because otherwise your treatment won't work.
Yeah, we're even seeing this now in natural health, where we have certain people coming along and they're saying, run all these tests and use like this herb for this virus or that herb for that other thing, and these aren't protocols really based on treating the people. These are what I would call very allopathic protocols, where you're just ignoring the person and you're trying to treat a lab result. And it's not that someone might not necessarily get help through this approach, but this type of approach is going to be not practical to run all between cost and availability of labs, and so forth. It's not something that's going to happen. And also, there are times someone will walk into my office and they come in with the stacks of labs, and it's not even there. But the one lab that is showing the problem, it comes back to, did the person just read the white blood cell count? Is their lymphocytes low? Those are the labs that more often than not, I'm like, okay, this is a barometer we can use. So it's not just simply about this is a cheaper lab, and this is a pretty cheap and easy to get lab test. It's very practical and useful.
Absolutely. Now, just basically almost finishing up our white blood cell types are the basophils. And basically, they are a marker for inflammation. They're not really specific, so they're not going to pinpoint the inflammation is coming from, say, your knees, or the inflammation is coming from, say, your muscles. But they are going to show that there is inflammation there, and that can be helpful if you're dealing with a lot of chronic pain, a lot of chronic fatigue, a lot of chronic skin issues, just to see how you're doing at addressing the inflammation.
Yeah, and let's go back up to monocytes. Monocytes work with neutrophils. Neutrophils more active at the start of an infection. Monocytes may increase afterwards. This is another lab you're going to see just misinterpreted all the time. They have this really, really big conventional range. You want to have monocytes low, less than 7%. If someone comes in and I see monocytes 9, 10, I'm going to think chronic infection. It shouldn't be all the way elevated, and just really look at that. It should not be 10. If it's 10, that's a chronic infection. That's really how it should be interpreted.
Absolutely. A great way to think of it is the neutrophils start the infection, the monocytes finish the infection. So you may start off having high neutrophils, but if you don't actively treat whatever infection that you have, over time the monocytes will actually take over, and your neutrophils will go back to normal or even low, but your monocytes will slowly increase.
Yeah, so that's when they're slowly increasing, they're up there. Look at it. And the last one is the eosinophils. And eosinophils, every from medical school, every nurse, everyone who's been through a medical program has to learn that elevated eosinophils indicate allergy or parasite. This lab is just routinely ignored. And if this is up there, I'm talking about out of optimal range, that's above 3. Look into allergies, look into parasites. I mean, I had someone who came in last year with chronic fatigue, and the eosinophils were elevated. Now, based upon that in history, I started working on parasites. You're talking about someone who'd been to the GI doctors. They did every possible GI test imaginable in conventional medicine for parasites. They did not find anything. And at the end, what he had was parasites, and that was finally discovered when it came out. But what was elevated was the eosinophils. The eosinophils were not like 14 or something. They were in the conventional range, but they were above optimal. And that's a sign that this can be a very important lab. So if you're suspecting allergies or parasites especially, you really have to look at this. Any weird case, or maybe it's a parasite, if the eosinophils are elevated, you really want to check up on it.
Absolutely, and this is very helpful because in many, many cases, the parasite test itself actually gives out a false negative. I remember when we were learning in school, we had a teacher who had someone do 12 tests specific for parasites, and it took 12 times before they actually got a positive.
Yeah, you never want to rule out parasites based upon a stool test. And at least if you're getting a test for parasites, you really want to go to someone like an HPAC doctor. Go to someone who's running a functional stool test. If you just get some standard stool tests from a gastroenterologist, they're just looking for a few things, and there's a very high chance that they're negative. There are companies like Diagnostic who run a much more advanced stool test that will find stuff. Okay, so we have like 10 seconds left, so we're just going to say goodbye.
Goodbye.